I'm Alisa Musalem, and thank you for joining us today as we kick off this webinar series. Just so you know a bit more about me, so I'm Alisa Musalem. I'm from Lebanon, currently living in France, and I'm currently the co-chair of the Young Leaders Council at GHA, and I will be your moderator for today's event. So at GHA, our mission is really to engage with the communities and grassroots organizations to drive really just transformational change in women's childhood and adolescents' health and well-being. And we've been doing a lot of activities around this, and today we're actually going to present some of those activities, and we'll be giving the chance for distinguished doctors to talk about their experience. And so we will have Dr. Marie-Michelle, we will have Dr. Michelle, Dr. Ini, and Dr. Winnie, who will be talking about their experiences in Reimagining Global Health. Kaita, you might want to go. Thank you for going to the next slide. And so I spoke a little bit about our mission and what we do at Global Health, and we just wanted to highlight our main values. So you can see them in the bottom. There are healthy people, healthy communities, and a healthy world. And going on with this mission and those three core values, Kaita might want to go to the next slide. We, over the past 50 years, more exactly 53 years, we've been able to create connections with people who are committed to empowering their communities, their own communities' well-being and health. And through that work, we've been able to train more than 10,000 global leaders to do that job. And through those 10,000, we've been able to help more than 60 million people to achieve better health and well-being in more than 90 countries. And so we're excited to share our vision and our mission with everyone. And I hope that this series introduces you to that world if you're not familiar with us. So just to, now that you know more about GHA, just a little housekeeping for today's meeting. This will be the first episode, if you want to call it, of our series. And you will have in the chat Yasmin, who's also part of my Young Leaders Council. And she will be moderating the chat, so she will be welcoming in people. She will be taking your questions. You might want to ask them in the chat or send them directly to her. And if you have any technical issues as well, you might want to also just directly send her a message on Zoom. With that said, I'll pass it on to Wendy.
Thank you, Alisar. So we know that the landscape of global health and development is always changing. However, I think we could all agree that 2025 has brought disruption unlike anything that we've ever experienced before. And while there has been a number of webinars, meetings, and quite a number of panicked conversations focused on the anticipating and emerging challenges of what we can probably call a post-USAID world. And note that I use that phrase to describe changes that go well beyond the shuttering of a single development agency. But here at Global Health Action, we realize that in the midst of these challenges, tremendous opportunities abound. Perhaps we see opportunities because of the incredible young students and early career professionals that we have the pleasure of coaching and learning from in our remote global health equity leadership program. Since 2020, 54 interns from 17 countries have joined us at Global Health Action for one or more semesters. Young people studying to become or already practicing as doctors, pharmacists, public health workers, monitoring and evaluation experts, and other professionals, each dedicating their lives to giving women and children in their communities a better chance at surviving and at thriving. These young people are change makers. They're full of ideas and new approaches to solving the huge challenges that exist in their communities and in our world. And perhaps our team at Global Health Action sees opportunities because of the passionate implementing partners we work with every day through our Ripple Effect program. This is our core work, bringing together government, faith-based, and community partners to co-create solutions to the greatest needs within the health systems and communities around the world. Here, too, we meet inspiring young community leaders, individuals who are literally paving the way for a better tomorrow in their villages, towns, cities, and countries. And it's from this inspiration that Global Health Action's 2025 webinar series was born, Reimagining Global Health, community-led solutions from the Global South. So today, I have the privilege of turning it over to 4 of our interns from 2024. Dr. Ini from Nigeria, Dr. Winnie from the Democratic Republic of Congo, Dr. Mishaal from South Africa, and Dr. Michelle from Haiti. And it is my pleasure for us to listen to them as they share and lead us in a dialogue now.
Yeah, over to you, Dr. Winnie.
Thank you so much. Hello, everyone. Good morning, good afternoon, good evening, depending on where you're located. Am I coming through well? Okay, can you hear me?
Yes, we
Okay.
can hear you well.
All right. Thank you all for joining us today. It's a privilege to be here for this important conversation as introduced by Wendy. So today's webinar topic is Voices of Change, Young Female Frontline Health Leaders in the Global South. Leadership for Lasting Change involve Global South women leaders' voices in policy and decision-making to drive change, impact health systems, and transform global health. Before we begin, let's take a moment to look at the current state of gender representation in the global health workforce based on the latest 2024 data from the National Health Workforce. As you can see, it has been estimated that women make up nearly 70% of the global health social workforce. Yet they hold only 25% of senior leadership positions. And a review of 200 global health organizations found that men hold 73% of executive roles, and women from low and middle income countries like ours were particularly marginalized, with only 5% of representation. This really highlights deep leadership gaps, especially for women from the global south. The workforce is also, please come back, thank you. The workforce is also highly gender segregated. While women make up 90% of nursing and midwifery, they are underrepresented in surgical and leadership roles, which are often more valued. So, what behind this imbalance? There are several systemic barriers, including occupational segregation, gender pay gaps, limited leadership pathways, workplace sexual harassment, and discriminations. These factors reinforce inequalities and limit women's potential to lead. That's why we're here today, to highlight these inequalities and push for a future where women, especially from the global south, lead the transformation of global health systems. Slide, please. Okay, now that we've set the stage with our welcome and introduction, I'd like to walk you through the rest of today's agenda. We'll begin with who we are. We'll introduce ourselves and share a bit about our background and experiences that brought us together. Next, we'll invite you to take part in a participant poll. That will be a quick and interactive way to hear your perspectives and build a connection across our virtual space. And from there, we'll move into stories from the front line, where we'll share powerful personal experiences from our work in healthcare systems, highlighting both challenges and resilience. After the stories, we'll pause for an audience reflection, a chance for you to process what you've heard and share your thoughts. And then we'll shift into our vision and mission, lay out the future we're working together and the principle guiding our movement. Following that, we'll share our key messages, the core takeaways and insights we hope will stay with you after today. And we've included a Q&A check-in at this point, and again at the end. So feel free to have your questions ready for those segments. As we move towards the close, we'll share our call to action, offering concrete ways you can engage, support, or take action in your own space. Then we conclude the presentation with a warm thank you and acknowledgements to recognize the incredible people and partnerships behind this event. Finally, we'll have a post-webinar survey and share a bit about the upcoming webinar, and we'll highlight how to connect with us so this conversation doesn't end when the webinar does. So we are really excited for the journey ahead, and thank you again for being here. Okay, who we are. Before we dive into the issues and solutions of today's webinar, we want to begin by sharing who we are and why this conversation is personal to each of us. So we are 4 young female physicians from different countries across the global south. Having worked directly on the front lines, we kind of bring firsthand insights into the realities of healthcare delivery, systemic barriers we've encountered, and the transformative power of gender-inclusive policies. We are also former interns at Global Health Action, as introduced by Wendy, and GHA is this organization that is hosting today's webinar. So in the following slide, in this one specifically, each speaker will introduce themselves, sharing their country, background, and field of expertise, so you can get to know the diverse perspective shaping today's conversation. Okay, that's me in picture number 1. So my name is Winnie Bakebua, and I am originally from the Democratic Republic of the Congo. I am a physician, and I earned my MD degree from the University of Kinshasa. And I began my clinical career as a junior physician in a public hospital where I provided primary healthcare services. My time in the clinical setting gave me first-hand exposure to the profound health challenges my community faces. Among the many pressing health issues, maternal and child health stood out as my greatest concern. That's why I quickly realized that while direct patient care is vital, I really wanted to kind of create a broader impact by reaching more vulnerable populations. This realization led me to join the Elizabeth Glaser Pediatric Ed Foundation, based in the DRC, a global health organization that most of you might know. And that was a turning point that marked my transition into public health. Over nearly 5 years, I gained invaluable experience in global program implementation, research, and evaluation in the field of HIV/AIDS prevention and treatment, contributing to the vision of an AIDS-free generation. Eager to expand my expertise and formalize my public health knowledge, I applied for the Fulbright Scholarship in the DRC, and I pursued a Master of Public Health at St. Louis University in the United States, concentrating in maternal and child health. And I graduated last year. But on top of that, I had a growing interest in monitoring, evaluation, and learning as a tool to enhance health programs. And that led me to join Global Health Action as an intern, an MEL intern in fall 2024. And that was an enriching experience that strengthened my skills in data-driven decision-making. So throughout this journey, I became increasingly aware of the gender disparities that persist in global health leadership. This awareness is precisely what brings us together today to spotlight those gaps, share lived experiences, and advocate for more inclusive, equitable health systems. Thank you all for listening. Now I'll pass it on to the next speaker on the screen to introduce herself. Over to you, Dr. Misha.
Thank you so much, Dr. Winnie, for that lovely introduction. So hi, everyone. My name is Dr. Mishaal Majeed, and I'm from South Africa. I began my journey in medicine at Wits University in Johannesburg, where I earned my medical degree. After graduating, I worked as a junior doctor at one of the city's largest and busiest public hospital complexes. And it was there, in the midst of long shifts, overflowing wards, and moments of heartbreak and hope, that I truly began to understand the leadership aspect of healthcare. So those years on the front line taught me more than any textbook ever could. I saw firsthand how deeply entrenched social and economic inequalities shape people's health in terms of who gets care, how soon they get it, and how effective that care can be. It was eye-opening and it was overwhelming, but more than anything, it made me determined to dig deeper into the systems that create these disparities and work towards solutions that are just, inclusive, wide-scale, and lasting. With this in mind, I then took a step beyond the hospital walls and pursued a master's in international health management at Imperial College in London, which I completed through my Africa Regional Scholarship and achieved the Dean's List of Excellence. So that experience expanded my perspective, allowing me to see the powerful intersection between healthcare policy, leadership, and equity. After my master's, I was incredibly fortunate to intern with the Global Health Action as part of the Leadership and Organizational Development Program. It was a space that not only nurtured my growth, but also reinforced my belief in the importance of local leadership and community-driven solutions. Following that, I then went on to explore the health tech sector, learning how innovation and technology can be harnessed to improve health systems, provide wide-scale solutions, and bridge gaps in healthcare. Throughout all of this, I have remained in touch with GHA, which explains why I'm here today, as part of this panel and as part of this conversation. And I'm truly honored to join such a powerful group of frontline professionals from across the Global South. And I'm equally grateful for everyone here for being here. And with that, I'll pass the mic on to our next speaker, Dr. Michelle, so she can introduce herself.
Thank you, Dr. Misha. Hello, everyone. My name is Mary Michelle Milord. I am a medical doctor from Haiti, and I am currently pursuing a master's in health services administration at University of Montreal in Canada. I began my career in clinical care, but I quickly realized that if I wanted to create meaningful and lasting change, I had to get involved in health leadership and policy. Over the past few years, I've worked at the intersection of healthcare systems, advocacy, and research. I served as the general coordinator of the Association of Private Hospitals in Haiti, where I supported health professionals and helped them to amplify their voices during moments of national crisis. And I am big shout out to Dr. Yvette Edward, who is here, and I also had the opportunity to intern at Global Health Action, GHA, and recently I complete a spring 2024 internship with GHA, where I work on project focused on strengthening maternal and child health outcomes in under-resourced communities. I can say that these experiences give me a deeper understanding of both the system barriers and the resilience that exists in global health, especially for women. They also reinforce my passion for building inclusive spaces that empower frontline professionals to lead with confidence and passion. And I am truly honored to be part of this conversation, of course, with two others beautiful female doctors, and to share this moment with all of you. And now I will pass it on to Dr. Ini. Thank you.
Thank you so much, Dr. Mary Michelle. Hello, everyone. My name is Inioluwa Atowoju, and I'm from Nigeria, although I earned my Doctor of Medicine degree from Kharkiv National Medical University in Ukraine. Now, living in both countries exposed me to the stark disparities in healthcare access and healthcare quality between an upper middle income country and a lower middle income country. This has helped shape my perspective on global health equity and women's health overall. My passion lies in maternal health, particularly safe childbirth advocacy, reducing maternal and neonatal mortality rates. Currently, I work with a maternal health insurance advocacy team in Nigeria, where we're striving to improve healthcare accessibility for mothers and pregnant women. And in spring of 2024, I served as the maternal and child health programs intern at Global Health Action, where I gained hands-on experience in public health research, data analysis, and I also learned community engagement, that is learning to interpret both the verbal and non-verbal cues to drive meaningful and transformative change in my community. Beyond maternal health, I'm deeply invested in global surgery and health equity. And over the past 3 years, I've served as co-chair for Incision Ukraine, the national working group for global surgery of Incision Global, which is an organization that advocates for educates young and upcoming future surgeons on global surgery. In this role, I've worked in advocacy, in education, and leadership to address surgical care disparities. And I'm honored to be a part of today's conversation. Thank you once again, GHA, and I look forward to learning from and engaging with you all here, especially the other 3 amazing healthcare professionals that I have on board with me. Thank you so much. I'll pass it back to Dr. Winnie to take the floor.
Thank you. Thank you so much, Dr. Ini. Now that you've got to know a bit about each of us, before we dive into the main content, would love to hear from you. Now I'll ask Michelle Agueta from GHA to please launch the poll. Okay, see this list, which presented keyword resonates with you most or is something you hope to gain from today's session. Please go ahead and choose one keyword and submit your answer. We have 3 minutes to do it. Remember, there are no right or wrong answers. We just want to understand what brought you here and what you're hoping to take away.
Right, up till now, we have 68% of participants who have responded, 70 now.
Okay.
If you're just joining, we're taking a poll. It's a 1-question poll, and you can quickly answer the question. If you haven't answered the question already, we ask that you do so.
For now, perhaps I'll share the results so that we don't take more than the 3 minutes, if that's okay. Wendy? I'll share the results and back to you once you see the results.
Okay. Thank you, Michelle, and thank you all for submitting your answers. These are the results. On top of the list, we have empowerments with 20%, followed by resilience with 14%, and representation hasn't been chosen, 0%. Okay. Thank you all for submitting your answers. Now that we know what you're hoping to gain, would like to present some of the realities faced by women health professionals on the front lines in the Global South. And these are lived experiences, as I said earlier, from our home countries. We'll start in South Africa, then move to Haiti, Nigeria, and finally to the DRC. With that being said, I'll turn it over to Dr. Mishaal to share a story from South Africa. Over to you, Dr. Mishaal.
Thank you so much, Dr. Winnie. So regarding my experiences being a junior doctor in South Africa's public health system, it was truly a test of endurance, physically, mentally, and emotionally. There are long shifts, often stretching beyond 24 hours, and that is the norm, as we made life-saving decisions with limited support. As a woman in this environment, the challenge was even more layered, with gender bias being ever present, both subtly and overtly. One of the biggest and most persistent concerns I faced was for my own personal safety during work, especially during the night, especially during my night shift in understaffed, poorly lit, and isolated facilities. The threat of gender-based violence wasn't just theoretical, it was a haunting presence that shaped how I moved and worked through each shift. What made it worse was the absence of adequate security measures, such as transport, personnel, and often functional response systems. These dangers are known, yet they're rarely acknowledged and meaningfully addressed by the systems that are meant to protect us. And so in this system, for us, every act of care is an act of resilience. However, resilience on the ground must be matched by representation at the top. In the article depicted, it is stated that despite the growing number of women entering medicine, they remain underrepresented in leadership across healthcare bodies. Women are often excluded from leadership due to caregiving roles, time constraints, and exclusion from aggressive professional politics. However, it's important to note that true leadership isn't about aggression. It's about impact, inclusion, and compassion. As such, all these issues must be addressed, not only to safeguard the physical and mental well-being of healthcare providers, but also to improve patient care and drive meaningful long-term change in healthcare leadership and healthcare systems, both locally and globally. Those of us who have lived this reality are not just witnesses, we are part of the solution. We understand the cracks in the system, not through reports or through secondhand accounts, but through sleepless nights, impossible choices, and unsafe conditions. And because we've lived it, we're better positioned to fix it through our comprehension of the day-to-day realities on the ground. That is why we're speaking up, because telling our stories isn't just about reflection, it's about transforming leadership, policy, and practice from the inside out. And with that, I'll pass it on to Dr. Michelle, who will talk about her experiences in Haiti.
Thank you, Dr. Misha. Now, let me take you to Haiti, a country where resilience is not just a trait, but it's a way of life. In Haiti, women represent around 34 to 40% of the medical workforce, according to the Ministry of Public Health. And yet, despite their essential contribution, they remain largely underrepresented in decision-making roles within hospitals and public health institutions. One of the biggest challenges is the leadership gap. Few women hold executive positions and even further have access to mentorship or structured leadership training. And this creates a glass ceiling that many struggle to break. Security risks also play a major role. And in recent years, I mean, over the past 2 years or 1 year, gun violence and political instability have drastically limited the mobility and safety of healthcare professionals, especially women. This discourages many from working in rural or underserved communities. One Haitian female doctor I once met, Natalie, I will call her Natalie, told me, there were nights when I worked 3 hours just to get in the hospital because public transport had shut down due to violence. But I kept going, not because it was safe, but because I knew women in my community needed care. This is the kind of resilience and dedication that many Asian women doctors show every single day, often without recognition. Additionally, social expectation weigh heavily. Asian women doctors often face the dual burden of professional responsibility and traditional caregiving roles at home, and there's no real policy framework to support in this balance. And finally, recognition remains a challenge. Most institutions lack gender sensitive policies or formal mentorship structures to uplift young female doctors. And still, many of us choose to stay, to lead, and to care. Not because it's easy, as I said earlier, but because it's necessary. Our voices matter, and so does our presence in leadership and in the transformation of health systems in fragile states like mine. And now, I will pass it on to Dr. Ini to get you to Nigeria.
Thank you so much, Dr. Michelle. I would like to share a short story with us before I go into the statistics. So there was a time I was in a secondary hospital in Nigeria, and I encountered a very heartbreaking case that I still carry with me. There was a 17-year-old girl. She was brought in, after a session of laboring at home with a traditional birth attendant. And by the time she arrived, her baby had no heartbeat. And, we on duty had to act very fast because she needed an emergency C-section to survive. What followed next was a race against time. There was no blood in the hospital bank. The surgical team was really overstretched and everyone was exhausted that day. And on the other end, there was a family that hesitated to give consent. So this was because the family itself, they were held back by the fear and stigma around C-sections. And so in that moment, we weren't just trying to provide medical care. I was trying to beg, we're trying to get blood in the hospital, doing a lot of coordinating and explaining. And thankfully, her life was saved. But that day, she left mourning a child and, questioning herself because where she comes from, the local community where she comes from, C-section is seen as a failure. Any woman that has to go through a C-section, cesarean section, is seen as, not capable enough to be a mother. And that moment wasn't just an exception for me. Each week brought different stories, but with the same similarities. There were avoidable deaths, delayed care, and women whose voices didn't even count, not in making decisions about their own body. And sometime later in a community health rotation, I met some very brilliant midwives and junior doctors who had deep insight into these issues, but they had no seat at the policy-making table. And just like that girl in the word, they were present, knowledgeable, but still unheard. Which brings me to the statistics in Nigeria. Women make up about 60% of Nigeria's health workforce, and it's the same women who are there delivering care. But out of the 60% of women in Nigeria's leadership health workforce, we have only 38% that are occupying leadership roles. This means that proximity doesn't equal power. And the more I thought about this, I recalled a common saying that I've heard on some wards in Nigeria. The saying goes this way: the girls make better medical students, but the boys make better doctors. And that phrase is telling something. It reflects how, for women, competence is seen as something very technical, but not something that is necessarily leadership worthy. And so today, I just want us to reflect on it. Equity in healthcare is not just about casual access to care. It's about who shapes the care, who speaks in these rooms where the reforms and the policies are made. And if we truly want a system that works for the people as a whole, then we must start by elevating the voices of women, not just in care, not just in providing care, and not just in the healthcare workforce, but we have to elevate the women's voices also in leadership, in policy, and in reform. With that, I'll pass it on to the next speaker, Dr. Winnie.
Thank you so much, Dr. Ini. Now I'd like to share a field story from the Democratic Republic of the Congo. So it was during my time working in a public hospital in the DRC, as I mentioned earlier. I witnessed firsthand how gender disparities in leadership can have life or death consequences. There's one moment I'll never forget. As a young woman, she was rushed into the emergency unit with severe postpartum hemorrhage, still one of the leading causes of maternal mortality in the DRC. And a highly experienced female nurse immediately recognized the urgency and recommended a blood transfusion and emergency surgery. She knew exactly what needed to be done, but she wasn't authorized to proceed without approval from a senior male physician who wasn't even available at the time. In those few minutes of waiting, the patient's condition deteriorated. It wasn't just the delay that struck me, it was the unspoken hierarchy at play. The nurse actually had the knowledge and the experience, yet her voice didn't carry enough weight because she was a woman. And sadly, this wasn't an isolated case. It's actually reflected a broader pattern that I saw across the system. Later, when I moved into public health work, I saw similar dynamics, this time in policy and program leadership. So in meetings to design strategies for like HIV prevention and maternal child health, the women who actually deliver the care, like midwives, nurses, community health workers, were rarely given space to shape the decisions. More often, those decisions were led by people far removed from the day-to-day realities. That experience confirmed something I now deeply believe. That is, empowering women in leadership isn't just a matter of equity, it's essential for effective life-saving healthcare. So when women's voices are heard at every level, like from clinic to policy table, we actually create health systems that are more responsive, more compassionate, and ultimately more impactful. Now, thank you so much for taking the time to listen to these powerful stories from South Africa, Haiti, Nigeria, and the DRC. These accounts reflect the everyday realities, challenges, and strengths of the Global South women health professionals on the front lines of care. Before we move on, we want to pause and open the floor to you. What about you? Can you relate to this in any way, whether through personal experience or something you've observed? If you had a chance to speak to a decision maker about what you've heard today, what would you highlight? For this, you can either raise your hand to speak or type your answers in the chat box. Please kindly be brief if you want to talk, because we want to give other participants the opportunity to talk as well. And make sure you choose one of the two questions to answer. So if you want to talk, you just have to raise your hands. Let's see. Can you relate to this in any way? Any thoughts, any comments? How these stories resonate with you? How do you feel about this? If you have any thoughts, any comments, you can either talk, raise your hand to speak up, or you can drop your thoughts, your comments in the chat box. Okay.
I can go ahead. Maybe that will what's the word in English? Motivate people to talk about their stories. But I would say I would relate to the first question where just a little background. I'm a clinical pharmacist by training, and I did my training in Lebanon and in the US. And when I was in Lebanon, I actually was working in a public hospital that catered to not just Lebanese citizens, but also refugees from Syria and Palestine with the UNHCR. And it was more specifically in the delivery, in the child delivery unit. And there were a lot of instances where, unfortunately, the voice of the patient was not heard. And no matter how much the nurses or me as a pharmacist on rotation tried to push for our patient's voice, unfortunately, the decision was always the doctor's decision, but most often the doctor was a male doctor who, with all due respect, just could not relate to some of the concerns that our patients had. Um, and we just really had to fight for our patients, but our decision was never, like, our voice was never taken into account for decision making, unless there were some feathers that were ruffled, and you know we had a very strong head nurse who would sometimes end up unfortunately getting into dispute with the doctor. But it was not a good dynamic. It shouldn't be that dynamic where our voices have to be heard. The only way it could be if there's a dispute, if voices are raised, or if in the background there will be like, hey, meet me in the office once we're done with the patient. And I'm really hoping that through our work, this paradigm shifts, and more of our voices get heard. And I see that Marjorie has her hand raised, and I'll let her speak.
Yes, thank you for holding this whole seminar, and glad to be included. I've been a global health nurse for all of my career. I'm now retired. I've had the opportunity to work many places, Latin America and Africa. I will say that even like here, but maybe not, well, definitely not to the extent, we don't have the problem of violence here that nurses experience in many countries. I will not say all, but in many countries in Africa and Latin America, it's a major problem. Trying to get institutions who are supposed to be supporting health to realize this is difficult. There are barriers to get them aware of the problem. And there's a problem with shortage of qualified staff. But the nurses are the ones who are at the bedside all the time. So that they get bullied, they get sometimes injured by patients, patients' families, and even physicians. It's the violence against nurses in some countries it's amazing that any nurses still work there. Yeah. So this is supporting what was just said with it. Akdialan? I'm not sure who it was.
Thank you. Thank you so much, Marjorie. Let's take a look at the chat. I see some thoughts coming from Raisa. She said, I believe I will highlight the importance of having women in leadership roles who can drive meaningful changes in the healthcare system. Our experience plays a crucial role in decision-making processes, and our life and work stories matters as well. Thank you so much, Raisa, for sharing your thoughts. And I see, I'll read some other notes from Prasi. Thanks so much for the great representation. I'm Prasi, a community health worker from Uganda. Do you people in Uganda, in the countries where you operate, may I know whether you work with CHW? If yes, how do you support them? Also, was actually a question. Okay, there are some other notes coming on the chat box. Thank you so much for sharing your thoughts at this point. I see Marjorie, hands raised again. Would you like to add something?
Yeah, just an addendum. I would say, you know, I spoke about nurses because they're the ones I have the closest experience with. But that often happens in societies where there is very strong, strict borders between male and female, period. Nothing, no other variation allowed, and strong dominance of males over females, such that in I'll just give one country, Botswana, which I love the people there. They're marvelous. However, the women put up with a problem that men believe that they have the right to strike and hurt their wives or their partners, and their partners go along with it. It's a very strong cultural split. I'm an anthropologist and I still call it a cultural split, and it was very difficult to deal with. I mean, I don't know how you deal with it. It has to be dealt with from the inside, not from the outside. And I was from the outside.
Thank you. There is some comment here from Mab Sayed. I hope I'm pronouncing your name well. So she said, in Sudan, my home country, one of the biggest barriers that women face is not due to lack of abilities and knowledge, but due to cultural norms and gender bias, which is always unfair. Okay, thank you for sharing your thoughts. And there is one more from Michelle Omolo. Women face greater barriers such as limited job security, pay gaps, and systemic gender bias. True equity means fair pay, fair opportunities, and a seat at every table. Thank you. Oh, okay. And I think we'll take Mary Esther Jean before we get to the next slide. Over to you, Mary Esther Jean. You have the floor to talk. Please unmute yourself and share your thoughts.
Thank you. And I want to thank every speakers for having the courage to speak about this topic and about all. I want to especially highlight the importance of including women in decision-making process and providing stronger support of women, especially in some countries like Haiti and many more. Thank you.
Thank you so much. Okay. I'll encourage everyone who has any additional thoughts, comments to drop them in the chat box. We'll be pleased to read them later. So now let's take a moment to ground ourselves in the vision and mission that unite our work. I'll now invite Dr. Mary Michelle to walk us through this segment. Then Dr. Ini will present why our voices matter and key messages we want to carry forward. Over to you, Dr. Mary Michelle, for our mission and vision.
Thank you, Dr. Winnie, and thank you everyone for sharing your history, your experiences. And now When I was a medical student in Haiti, I often looked around the hospital and saw brilliant, passionate women giving their all to patients, families, and communities. But very few of them were in leadership roles. That word remain in the conversation, the leadership gap. And as you can see, yes, leadership is a common word based on each experience of the panelists, even you as the audience, and that always stayed with me. Today, I want to thank JJ for this webinar. And our vision is clear, a future where women are not just present in healthcare, but leading transformation. And we imagine young women from the global south at the center of innovation, advocacy, and decision making. And like that, shaping policies and building stronger, fairer systems. And all about our mission is simple: empower, support, and elevate. We empower through mentorship because leadership starts with confidence. We support by advocating for spaces where our voices drive real change. And we elevate by nurturing well-being because resilience is key to sustainable leadership. And this is more than a mission, it's a movement. And I am so proud to be part of it. And with that, I want to ask all of you to open your mic, please, and to say thank you to JJ for supporting frontline leadership and investing in women led solutions. One, two, three. Please open your mic to say thank you, JJ. I'm waiting for you.
Thank you, JJ.
Thank you, JJ.
Thank you,
Thank you,
JJ.
JJ.
Thank
So
you. Thank you.
over to you, Dr. Ini, for why our voices matter.
Thank you so much, Dr. Mara Michelle. And thank you everyone for your contributions so far. Why do our voices matter? I would like to just read a comment I saw in the comment section by Michelle Omolo, and it says, women face greater barriers such as limited job security, pay gaps, and systemic gender bias. True equity means fair pay, fair opportunities, and a seat at every table. And that exactly is why our voices matter, to push for equity in healthcare. Being a young female leader in healthcare isn't just about having a title or being famous as a shero. It's about stepping up and taking responsibility and driving real change. And so together with the other three panelists on today's webinar, we come with resilience, with our lived experience. I believe you've heard our stories in a few slides prior, and with professional training. And we're using all three to transform healthcare, not someday, not sometime in the future, not sometime in 100 years to come, but right now. But let's be honest, the road isn't actually an easy one. We face real life challenges, and we've seen some of them being mentioned in the comments. One of which is gender bias, from the subtle stereotypes, from the cultural stereotypes as well, to outright exclusion of women in healthcare leadership. Women have been in situations and instances where they have to constantly prove their worth. And, even in rooms where our voices should already be valued, we find ourselves pushing to make sure that we are not silenced. We also have the issue of systemic barriers, which could be institutional norms in some of the healthcare facilities where these women in the global south work, and outdated policies that should have been revised and revisited over the years. These things make it harder for us to lead to innovate, and to break the traditional power dynamics and structures. We also have the issue of limited resources. As you all know, the 4 women on the panel session today, we are all from the Global South. And we work in systems where, there's too little funding, inadequate infrastructure, or even not enough support. And yet, we women in Global South are still expected to deliver. But here's the thing. Like Dr. Michelle rightfully thanked GHA. GHA, I would like to thank you once again for organizing today's webinar. We refuse to be silent, and GHA is also at the forefront of that, making sure that women in the Global South in healthcare have their voices being heard. And in response to this, we are trying our best to challenge the outdated policies that have sidelined the female voices for far too long. We're also trying to learn from the trailblazers, the women leaders, the women in healthcare that have come before us, and we're standing on their shoulders as we build something more inclusive within the Global South. We're also turning our obstacles into opportunities. This is not just for ourselves, but for the communities that we serve in, so that women's voices, whether in healthcare or in the community, are heard. The truth of the matter is that it's the women healthcare workers that know the community best. We are the ones on the front lines, listening, observing, treating, and advocating. We're the ones directly engaging with the patients, with their families, and sometimes even with these policymakers. And so I would just like to leave us with this question: who better than us to amplify the voices and stories of our people? You see, as women in healthcare, we're not just participants in the healthcare space. We are the leaders, we are the change makers, and we are the future. And with that, we'll be going on to the next slide, please, where we'll see our key messages to the world. Thank you very much. Now, this is our message to the world. It's quite simple. It's in 3 phases. And I already talked about us being young female health leaders. And while we're not just preparing to lead, we're already doing our best to lead this change. But to build a system that is stronger, more inclusive, the world has to do more than applaud us from the sidelines. They have to break out of the backstage support. And the first thing we're doing is to call for recognition and inclusion of women in decision-making. Our voices, our insights, our lived experiences are not optional in recognition when it comes to decision-making. These are essential things, essential tools that are going to be helpful in designing policies that actually work for these communities that we serve. We can't claim to solve problems when women are sidelined, and it's just the men that are up there in the policy-making rooms. So for the problems to be solved, there has to be a balance between healthcare leadership for both women and men. The second thing is investment in young female health leaders. Leadership is not something that just happens overnight. It is something that is cultivated. And so we need mentorship, we need training, we need sufficient resources and the space to grow. Because the truth is, when you invest in women, you are investing in the future of healthcare. The third is we're calling on strengthening healthcare systems with gender equity in health as the focus. Healthcare systems, it thrives when the leadership is diverse and very inclusive. And so when women are equally represented on this table, we have more grounded policies, we have more responsive policies, and we have more innovative policies. And so rather than keeping equity as just a moral argument, it's a practical one. So this is the truth. It's our time to act. Now is the time to commit. we can together build a healthcare system where young female leaders are not only seen or supported in the background, but where they are heard, they are supported both in the background and in the front lines, and where they are empowered to shape the future. Thank you very much. I'll be passing it on to our next speaker. Dr. Winnie will take the floor for the Q&A, I believe.
Okay, thank you, Dr. Ini. I think we'll keep the first Q&A check-in for the end. Let's move on and get our call to action. So for this, I'll pass it on to Dr. Misha, Dr. Ini, and Mary Michelle to present the next slides.
Thank you so much, everyone, for all the contributions you made to the chat and to all our speakers so far. So with regards to our call to action, we know that women make up a significant portion of the global healthcare workforce, yet they remain underrepresented in leadership and decision-making spaces. So if we truly want to make a more equitable and effective healthcare system, we must take action. As such, our call to action is for policymakers, organizations, and global health actors. First, we need to advocate for change. Global health leaders must commit to gender equity, not just in words, but also in action. One key step is increasing women representation in leadership roles by setting clear gender equity targets within healthcare institutions. Second, we must amplify women's voices in decision-making. This means ensuring female representation on hospital boards, advisory councils, and policymaking bodies. Third, mentorship and sponsorship programs need to be strengthened. Partnering with universities and professional associations to provide leadership training for women in medicine and public health will help build a pipeline of strong female leaders. Fourth, investment in capacity building is also essential. This includes funding scholarships for women in healthcare management, public health, and leadership programs, as well as creating exchange programs that provide global healthcare leadership exposure. Finally, gender-sensitive workplace policies must be prioritized. Equal pay, transparent promotion criteria, and flexible work arrangements will help create an environment where women can also thrive. Additionally, we must develop workplace safety policies that address harassment and discrimination, ensuring safe and effective reporting mechanisms. This is not just about equality, it's about strengthening healthcare systems for everyone. And I'll pass it on now to Dr. Inu to continue this discussion.
Thank you very much, Dr. Michelle. This is a message to our allies. How can our allies support young female health professionals? Real change in healthcare demands a very intentional partnership, and the allies, be it our colleagues, our mentors, the institutions where we work with, or policy makers, are not just supposed to be bystanders in this change. They're supposed to be the bridge makers, and their role goes beyond verbal support to the tangible everyday actions that shift systems and empower young female leaders in health. So one of the things the allies can do is to normalize equity conversations in daily practice. Allyship it's not just for the campaigns or the conferences. It starts in the everyday, the day-to-day, in the ward rounds, in the research meetings, in the staff lounges. Allies have to initiate and normalize conversations around gender equity until it's not something that is just seen as an exceptional thing, but it becomes something that is expected and accepted and receptive to all people. Another thing is to share the mic and the stage. Sometimes real support is in stepping aside. That is offering, speaking slots to young female leaders, offering authorship credits, media features, like what GHA is doing today, and letting the young female health professionals shine through, unfiltered, unedited, and unmuted. That is when this kind of visibility can start to change the narrative. Another thing our allies can do is move from silent support. I think I earlier mentioned that not just backstage support, but moving from silent support to strategic advocacy. Quiet agreement and quiet support is something that is no longer enough. The true allies need to speak up, even when it's uncomfortable. And that is when pushing back when women are interrupted, questioning biased selection panels. Advocacy has to be something that is visible, that is deliberate, and very strategic. Our allies can also help build peer networks and not just the top-down mentorship. Mentorship matters. Mentorship is very important for young female leaders and women in healthcare in general. But so do these horizontal peer networks. So what allies can do is to help young women, from across the global south, connect across disciplines and across borders and build peer networks. This way there can be webs of shared knowledge, growth, and resilience amongst the women. Peer power is a way we can multiply leadership of women in healthcare. Then finally, our allies need to acknowledge the bias and then do the work. As an ally, being an ally starts with awareness, but it doesn't just end there. Allies need to acknowledge the bias, also look within themselves, and then do the work to change it. That is what true allyship is about. It's not about performance. It is not passive, but true allyship is powerful, it is persistent, and it is rooted in action. With that, I'll be passing it to Dr. Michelle.
Thank you, Dr. Ini. As you can see, we each bring different experiences from hospitals, rural clinics, policy room, and academic spaces. But what unites us is a shared commitment to equity and transformation. The ways to collaborate are simple. Let's act together. Oh, first, let's create mentorship networks across borders so no woman has to navigate leadership alone. Secondly, let's center mental health and resilience because leading should not mean burning out. Third, let's make sure our voices are not only heard but influence real policy and decisions. And finally, and most importantly, let's build solutions with the communities we serve, not for them, but with them. Change starts with us and it grows when we move together. With that, I'm passing back the floor to Dr. Winnie.
Thank you again, Dr. Mishaal, Dr. Ini, and Dr. Mary Michelle, for your powerful insights on our call to action. Now, as we move towards the end of this presentation, I'll encourage you all to drop your questions in the chat box. We'll be pleased to address them all at the Q&A slide coming down there. So let's revisit the core issue we've been addressing. We said that women health professionals from the Global South, despite their proximity to health challenges and their potential as change makers, remain significantly underrepresented in health policies and decision-making spaces. They face persistent barriers that we discussed about. To address these inequities, we propose centering their voices and lived experiences, meaning investing in their leadership, creating safe and inclusive platforms for participation, and providing mentorship and resources, and also actively dismantling structural power imbalances within health systems. As we look ahead, we call on funders, policymakers, academic institutions, and organizations to move beyond symbolic gestures. It's time to create a real space, share decision-making power, and support women health professionals from the Global South, not just as participants, but as co-leaders in global health. Now, I'll pass it on to Alyssa. To present the post-webinar survey before we take the questions. Over to you, Alyssa.
Yeah, well, thank you for the 4 amazing doctors for presenting their experiences, their thoughts, and views. If you enjoyed this webinar, there's going to be just now a post-webinar survey that you will be answering. It should take you around 2 to 3 minutes. And Yasmin just put it in the chat. So if you could please enter the link, put in your answers, and again, it should only take around 2 to 3 minutes. Also, let us know if you're having issues getting into the link or entering the web. I just tried it myself now, and it works just fine. I think we can give people until we can let people fill in the survey, maybe give just like maybe a minute before we move on to the next part. Marjorie is saying that like on the post-webinar survey does nothing on her screen. It should open in a web browser, Marjorie. If not, you can try to maybe copy the link and put it directly in your browser if the link is not working on the Zoom chat.
I also want to add, it would be best if you could open it in Google Chrome or something like that, because it usually works well with any Google related app. If you have Google Chrome, perhaps you can open that browser.
Thank you, Michelle. I think we can give a few more seconds before we move on to the next.
Let's actually go ahead to the next slide while people are filling it out.
Yeah, thank you. That's a good idea. Okay, so as mentioned in the beginning, this is the kickoff of a series of webinars, and we will be having 2 upcoming webinars, one in July and one in August. And so if you are interested to attend those webinars, the links for participation will be up soon. Michelle will be distributing them. You might see them on social media or sent to you directly on your email. And so I believe Michelle has her words now.
Yeah. Okay, so we've talked about the challenges in global health and the urgent need for action, but real change happens when we come together to make a difference. That's why I want to invite all of you to get involved with global health action. GHA is committed to strengthening health systems, supporting marginalized communities, and empowering leaders in global health. Whether you're a student, a professional, or someone just passionate about making an impact, there are many ways to engage with our movement. The easiest way is by visiting our website at globalhealthaction.org, where you'll find information about our organization, programs, events, and opportunities to get involved. Some ways to get involved include spreading the word to help raise awareness, by sharing our work with your networks, apply for the internship program to gain hands-on experience in global health and advocacy, join the Young Leaders Council, which is an opportunity for emerging leaders to contribute to shaping policies and programs, volunteer. Whether you have a few hours or long-term availability, your skills and time can make a meaningful impact. And finally, donate. Every contribution, big or small, helps expand our programs and empower those who need it most. So if you have any questions or want to stay updated, you can reach out through various routes, such as visiting the website, emailing, or calling us. And of course, stay connected with GHA on social media. So follow, share, engage through all the links and QR codes shown on the screen. Also, please feel free to reach out to all of our speakers here today, including myself, Dr. Winnie, Dr. Inni, and Dr. Michelle. We will share our LinkedIn profile links in the chat box. So please do connect with us. Please do engage with us. Please do stay in touch and send questions our way so we can continue this conversation even after this webinar. And remember that the work we do together shapes the future of global health. So join us, take action, and let's make a difference together. And then I'll pass it back to Alisar for some final GHA information.
Thank you so much, Michelle. So as she just mentioned, if you enjoyed today's webinar and you want to keep up with GHA's work, you might want to sign up for the newsletters by scanning the QR code here. And if you enjoyed also, to support this series and the vital work that we do at GHA, please consider donating by scanning the QR code or just going directly on the GHA website. With that said, I think I just want to really thank everyone, and we can move on to the Q&A session.
You're muted.
Okay.
All right.
Thank you so much, Elisa, and thank you all for being part of this conversation. A heartfelt thank you to our incredible speakers for sharing such powerful stories and insight from the front lines, and to you, the audience, for your presence, your reflections, and your thoughtful engagements. Your participation reminds us that we're not alone in this work, and that together we can push for deeper and more meaningful change. And I also want to send a special thank you to Global Health Action for providing the platform and support to make this dialogue possible. Your commitment to elevating the voices of global South women health leaders is both meaningful and necessary. And we hope you all leave this session inspired and ready to champion change in your own space. So let's keep the conversation going. That being said, I'll invite you to reflect on this last question before we get to the Q&A. What changes within your own institutions, your networks, and your mindset are needed to truly elevate global South women health professionals' voices and leadership? So feel free to drop your thoughts into the chat box, and then we'll move directly to the Q&A. For this, you have two options, either dropping your question in the chat box, or as we did earlier, you can raise up your hand, unmute, and ask your question. This is your chance to engage with us, share your thoughts, or ask any question you may have about what we've shared so far. So please feel free to raise your hands, to speak, or drop your questions in the chat. We'll first take 2 or 3 questions depending on time. Okay, let's see what's in the chat box. Come on, ask your questions.
I believe, so we have 2 questions actually, if you want to go back into them. We have one question from, hold on, I saved them. We have one question from Prosi from Uganda. I don't know if they're still with us, but they asked, whether all 4 of you doctors work with community health workers in your country, and if you do, how do you support them?
Okay. That's a great question. Thank you for bringing that up. Dr. Mary Michelle, Dr. Ini, Dr. Michelle, would you like to take this one?
I can go ahead and answer that. So as a junior doctor from South Africa, we've definitely seen how vital community health workers are in our community, not just in terms of delivering care, but also in terms of building trust within our communities. So in places where clinics are very far and health services are very stretched thin, community health workers often become the first point of contact for a lot of patients. So in the countries where we work, we do engage a lot with CHWs. The way we support them varies depending on the local context. So in general, we focus on listening to what CHWs themselves say that they need. And that often means offering them training, tools, and resources to help them do their jobs more confidently and safely. And we're also try to ensure that they're included in decision-making processes because they understand their communities and the ground reality better than we do. So we do believe in our state that for any health system to work well, especially in rural or underserved areas, CHWs have to be empowered, supported, and valued. And this is not just as volunteers, but also as crucial health team members. So I hope that does answer some of the question.
I would like to add that in Haiti, community health workers, known as agents de santé communautaire polyvalent, play a crucial role in extending care to remote and underserved populations. And personally, I have collaborated with them in various capacities, especially during community-based maternal and child health programs. However, they often face major challenges, low or inconsistent pay, lack of formal recognition, and limited access to ongoing training. And supporting them means not only integrating their voices in health planning, but also advocating for fair working conditions and capacity building. They are the backbone of primary care in fragile contexts like Haiti, and any health reform must, prioritize them. So, yeah.
I would also like to point out that GHA helps in building training curriculums for community health workers and TBAs in parts of Haiti and India and some other parts of the global south. So it's something GHA works on doing, and GHA is currently doing at the moment. So I just wanted everyone to be aware of that. So thank you, GHA, once again for the great work.
Thank you so much. I'll also add something. As I mentioned in my bio, I worked in HIV/AIDS prevention and treatments program. So I had the opportunity to work with CHW. So we kind of helped them, supported them during my work in that program in capacity building and also providing resources for them to, access the community, especially underrepresented, marginalized communities. And because as my colleagues have just said, they know their community better. So we couldn't reach the target population without their help. So we were really working along with them. They were really included in everything we were doing and also in the decision making because they were really serving as the pathway for us to reach the people we were targeting. So yes, I would say yes, definitely. I had to work with community health workers in my experience, my own experience, and I also had the privilege to support them, and in order to reach the people we wanted to help.
I think we had one more question that still needs to be answered. So I think Abdi Alam had a question, so I'm just going to quickly speak to that before we close off, and I think that's the last question we'll answer for today. But in terms of your question, Abdi Alam, so I think one of the biggest barriers now is how international funding flows. Funds currently, as we all know, are often channeled through large northern-based NGOs or agencies who then subcontract to local partners. So this not only sidelines local leadership, but it also means Southern women leaders are often stuck implementing someone else's vision instead of shaping their own agenda from the start. So to change this, we need more direct investment in women-led organizations in the global South. And for that true change, we need to shift who sets the priorities, who controls the purse strings, and who gets to speak. And that means rethinking the selection criteria for leadership roles, creating safe and inclusive spaces, and enabling diverse voices. So ultimately, dismantling these structures does require courage and humility from those who currently hold the power, and also from those who don't hold the power. It requires consistent pressure for everyone who's fighting for equity. And I hope that does speak to your question. And I'll give it back to Winnie to end off the webinar.
Yeah, thank you all. Thank you all for these thoughtful questions and reflections. It's clear from our discussion that this conversation resonates deeply with you. Now, I'll hand it over to Alisa, who will guide us through the closing remarks and wrap up this session. Over to you, Alisa.
Okay, thank you. Well, that was a very fruitful conversation. Thank you, everyone, the speakers, the attendees, and again, everyone at GHA and GHA itself for all the amazing work that you are doing. And again, if you are interested, keep in touch, sign up for the newsletter, get in touch with us on social media. And if Wendy has anything to say, I'll let her wrap up. If not, this is it, folks. Thank you so much for joining us.
I'll just say thank you to these incredible presenters. This is all that we had hoped this session would be, and the reason we are doing this webinar series. Everyone who's here today, we hope to see you at the next webinar, and have a great rest of your day or evening. Thank you.